The thyroid and parathyroid glands secrete hormones that affect overall metabolism, electrolyte balance, and excitable membrane activity. Problems of either gland usually have a widespread effect and manifestations. Mild disturbances produce subtle problems. More severe disturbances may produce life-threatening problems. This lesson will cover thyroid and parathyroid gland problems and how to care for the patient experiencing these gland problems. After this lesson, you will be able to identify teaching priorities for the patient taking thyroid hormone replacement therapy, be accepting of patient behavior and changes in appearance, compare the clinical manifestations of hyperthyroidism with those of hypothyroidism, interpret clinical changes in laboratory data to determine the effectiveness of interventions for thyroid problems, and compare the clinical manifestations of hyperparathyroidism with those of hypoparathyroidism. To start out, we will first discuss thyroid gland disorders. The thyroid gland disorders are caused by hyperfunction, hypofunction, inflammation, or abnormality. The hyperfunction is known as hyperthyroidism. Hypofunction is known as hypothyroidism. An inflammation of the thyroid gland is known as thyroiditis. And an abnormality is referred to as thyroid cancer. Hyperthyroidism is an excessive excretion of T4 and T3. Some of the manifestations are referred to as thyrotoxicosis. There is an increase in metabolism in all the body organs. It can be temporary or permanent. Hypermetabolism leads to an increased sympathetic nervous system activity. There is an increase in heart rate, which increases cardiac output, the systolic blood pressure, and blood flow. There is protein synthesis and degradation increase, which is referred to as a negative nitrogen balance. There is glucose tolerance decrease, which leads to hyperglycemia. And then there may be fat metabolism increases and body fat decreases. This is identified as Graves' disease. Clinical manifestations can be fine, soft, silky body hair, smooth, warm, moist skin, diaphoresis, thinning of the scalp hair, shortness of breath, shallow respirations, decreased vital capacity, muscle weakness and wasting, amenorrhea, decreased menstrual flow, increased libido, increased basal metabolic rate, heat intolerance and low-grade fever, and or fatigue. The patient may also experience palpitations, chest pain, increased in systolic blood pressure, widened pulse pressure, tachycardia, dysrhythmias, weight loss, increased appetite, increased stools, hypoproteinemia, goiter, exophthalmos, decreased total white blood cell count, enlarged spleen, and manic behavior. The patient may also experience blurred or double vision, eye fatigue, corneal ulcers and infections, increased tears, red conjunctivae, photophobia, eyelid retraction, glow blag, hyperactive DTRs, tremors, insomnia, decreased attention span, restlessness, irritability, and even emotional lability. Diagnostics include thyroid profile, a radioactive iodine uptake, which will remind patients that there will be urinary precautions, stool precautions, clothing precautions, food precautions, and utensil precautions. Other diagnostics are thyroid scan, an ultrasonography, and an ECG. Treatment will include maintaining a calm atmosphere and avoiding stimulants. You want to monitor vital signs, watch for CHF. You want to watch for the longevity of medications because there is an actual increase in medication turnover time. Um, they will need increased calories of nutritious foods. You want to monitor daily weight. They may need to wear eye patches or sunglasses. They definitely don't want no aspirin because it releases T4 and you want to keep it in a cool room. And then you want to teach about the disease, possible complications, potential medications, and then the different treatment options and their effects. Other treatments can include medications that inhibit T4 converting to T3. You want to watch for rash and granulocytosis in tapazole. There's also potassium iodide. It has a bad taste. It can stain the teeth. Generally have them use a straw to take it. And it decreases the size and vascularity of the thyroid. Medication teaching for the patient should include signs and symptoms of hypothyroidism, how they are to monitor their pulse and their temperature, when they need to report a rash and frequent infections, and you also want to teach them to never stop taking their medications abruptly. You may have to explain and educate on thyroidectomy, which is rarely done for hyperthyroidism, but if so, they will have to have a replacement of radioactive iodine. This is a form of iodine that gives off a poisonous type of radiation. The thyroid cells will absorb it and they'll be damaged or killed, which then can result in hypothyroidism. Then we have the thyroid storm. This is a sudden, extreme, or overactivity of the thyroid gland, a life-threatening emergency. Even with treatment, mortality is 25%. There is a release of large amounts of thyroxine causing extreme elevations in all body processes. If thyroid storm is suspected, avoid aggressive palpation of thyroid gland. Some of the clinical manifestations of a thyroid storm is the patient will have a temperature greater than 105, a pulse greater than 200. They may experience paranoia and hypertension. Treatment requires cooling blankets, beta blockers, iodine, and fluids. In hypothyroidism, the body lacks sufficient thyroid hormone T4 and T3. This can be caused by inflammation of the thyroid gland, thyroid peroxidase antibodies, a surgical removal of the thyroid, the radioactive iodine treatment, or pituitary gland not producing enough TSH. Like growth hormone, it's hard to find a tissue or system in the body that is not influenced by or impacted by thyroid hormone. The epidemic is subclinical hypothyroidism. Think pulse rate and body temperature. Association of development of diabetes and hypothyroidism can occur. Clinical manifestations can be cool, pale, or yellowish, dry, coarse, scaly skin, thick, brittle nails, dry, coarse, brittle hair, decreased hair growth with loss of eyebrow hair, poor wound healing, hypoventilation, pleural effusion, dyspnea, decreased basal metabolic rate, decreased body temperature, cold intolerance, and weakness and/or fatigue. Some other clinical manifestations are bradycardia, dysrhythmias, enlarged heart, decreased activity tolerance, hypotension, muscle aches and pains, delayed contraction and relaxation of muscles, apathy, depression, paranoia, withdrawal, anorexia, weight gain, thick tongue, increased sensitivity to opioids and tranquilizers, and folate and vitamin B12 deficiencies. The patient can also experience constipation, abdominal distension, slowing of intellectual function, lethargy, confusion, hearing loss, paresthesia, decreased tendon reflexes, changes in menses, decreased libido, periorbital edema, facial puffiness, non-pitting edema, hoarseness, goiter, decreased urine output, and or even anemia. Diagnostics will be a thyroid profile checking the increased levels of TSH or a decreased level in T3 and T4. The treatment will include thyroid replacement. The education you will provide is it may take 2 to 4 weeks to build therapeutic level. Do not self-dose. Medications require lifelong follow-up. You want to check daily weight. Don't eat for 1 hour after taking the Synthroid, and don't take calcium supplements within 4 hours. You will also need to teach patients to be cautious with over-the-counter medications. Teach them how to take their pulse and their temperature. Remind them to decrease their caloric intake. You need to tell them they need to be cautious with taking sedatives and why. You want to also caution them with fluid intake. Cretinism is due to a decrease in T4 and T3 from birth. It results in dwarfism. It can cause retardation mental and physically. Some of the clinical manifestations are a thick skin, flabby, waxy in color. The nose is flattened, the abdomen protrudes, and there is a slowness of movement and speech. If it is discovered early enough, it can be improved. If cretinism persists into adulthood, then it becomes myxedema coma. Hypothyroidism precipitated by infections and or certain medications, such as sedatives. It is rare and life-threatening. There are multiple organ abnormalities. It will have a progressive mental deterioration. There will be hypotension, hypoventilation, and or facial edema. This is the end of part 1 of module 2 of alterations of the endocrine system.